Welcome to your MAP February 2020 update training. Today we're going to talk about the Medicare 2020 updates, documentation, unique IDs, confidentiality agreements, and recertification. For Medicare 2020 update information, we'll be talking about the Part A and Part B premium and deductibles, Medigap updates, telehealth coverage, updates to Part B drug step therapy, Part D formulary design and auto ship policy, and LIS and MSP asset limit changes. Medicare Part A premium and deductible. The Part A deductible has increased from $1,364 in 2019 to $1,408 in 2020. That is an increase of $44 total. The premium is going to range based on the quarters that the individual worked and paid into Medicare. For an individual who worked less than 30 quarters, the monthly premium is going to be $458 per month. For an individual who worked 30 to 39 quarters, the monthly premium is $252 per month. And anyone who's worked 40 quarters or more, the premium is $0 per month. Medicare Part B premium and deductible. The Part B deductible has increased from $185 in 2019 to $198 in 2020. That is an increase of $13. The premium increased from $135.50 in 2019 to $144.60 in 2020. That is an increase of $9.10. A small percentage of beneficiaries who were subject to the hold harmless provision will pay less than the $144.60, as the increase to their Social Security benefits will not have been large enough to cover the increase in the Part B premium. Medigap updates. As a result of Medicare Access and Chip Reauthorization Act of 2015, also known as MACRA, individuals newly eligible for Medicare on or after January 1st of 2020 will be unable to purchase Medigap plans that cover the Part B deductibles. That would be plans C and F. The limitation also extends to the Plan F high deductible. If a beneficiary is eligible for Medicare before January 1st of 2020, the beneficiary retains the right to purchase Plan C or F after January 1st, 2020 if they are within their Medigap open enrollment period or have a Medigap guarantee issue right. If a beneficiary has either Plan C or F, their plan will remain viable and active as long as the premium is paid. For those beneficiaries, federal guarantee issue right is not available if the plan becomes unaffordable. MACRA is making both Plan G and D a guarantee issue plan for those that are newly eligible Medicare beneficiaries, and they are not able to sign up for C or F. If the beneficiary is Medicare eligible before 2020, then they will not be given guarantee issue for Plan D and G unless it is their Medigap open enrollment period. This is because those beneficiaries are still eligible for Plans C and F. Medigap Plan F high deductible is being discontinued because it falls under Plan F, and the new high deductible plan being offered is under Plan G. The deductible will be $2,340 for the year, and in 2020, any beneficiary can sign up for the high deductible Plan G regardless of their Medicare eligibility date. It is available starting January 1 of 2020. Technology-based services telehealth. Medicare statute dictates that telehealth services may only be provided by approved originating sites, typically a healthcare facility for beneficiaries that reside in rural areas. To facilitate telehealth expansion in both fee-for-service and Medicare Advantage plans, CMS has utilized its rulemaking authority to reclassify some telehealth-like services into communication technology-based services, thereby bypassing the statutory telehealth restrictions. As a result, Original Medicare has begun paying for virtual check-ins across the country, meaning patients can now connect with their doctors from their home by phone or video chat. Usually, the check-ins are designed to determine if the patient's condition warrants an in-person visit. Beginning July 1st, 2019, The Support Act removed the originating site geographic conditions and adds an individual's home as a permissible originating telehealth service site for treatment of a substance use disorder or a co-occurring mental health disorder. Beneficiaries will pay 20% of the Medicare approved amount for physician or other healthcare provider services and the Part B deductible when applicable. Most telehealth services cost the same amount as the in-person services, and beneficiaries always have the option to be seen in the office, and beneficiaries should contact 1-800-MEDICARE if they experience a reduced in-person access to the provider. Any claim denials should be addressed using Medicare Part B appeals process. In 2020, Medicare Advantage plans may begin offering a new type of basic telehealth benefit in addition to current supplemental telehealth benefits. These additional telehealth benefits allow Medicare Advantage plans to deliver Medicare Part B benefits through telehealth services when clinically appropriate. CMS stipulates that Medicare Advantage plans must continue to offer enrollees the option to receive the covered benefit in person, and the telehealth benefits must be provided by a contracted and credentialed provider. Given the increased categories of telehealth services, Medicare Advantage enrollees should confirm their plan limitations and copayments prior to receiving services. This can be done with the Medicare Advantage plan provider. Denial of telehealth benefits can be appealed through the Medicare Advantage organizational determination process. Updates to the Part B step therapy drugs. Beneficiaries who are actively taking a drug covered under Part B are exempt from the step therapy requirement. CMS has implemented a 365-day look-back period to determine if the beneficiary is actively taking the drug in question and if the new step therapy can be implemented. CMS also codified that plans have the flexibility to cross-manage between Part B and Part D drugs. MA plans participation in Part B step therapy must disclose the Part B drugs may be subject to step therapy requirements in the plan's annual notice of change or evidence of coverage documents. Medicare Advantage plans must respond or allow beneficiaries to expedite a coverage request or appeal a denial of such a request within 24 to 72 hours. Part D formulary designs and auto-ship. Let's first take a look at what it is. Part D indication-based formulary design is a formulary management that allows plans to include or exclude drugs on a formulary based on indication or diagnosis. In 2020, if a Medicare Part D plan decides to restrict on-formulary coverage of drugs to certain indications, it must ensure that another therapeutically similar drug is included on the formulary for the non-covered indication and communicate it with beneficiaries. It is important that beneficiaries not only determine that a drug is on the formulary while doing a plan search, but they will want to also confirm the plan's formulary coverage based on their diagnosis or condition. Utilization of indication-based formulary design must be disclosed in the plan's annual notice of change or EOC documents and on Medicare Plan Finder. Requests for coverage for excluded indication are considered exception requests for an off-formulary drug. Beneficiaries must contact the plan to initiate an exception request, and plans must provide written notice of its coverage decision within 24 hours for expedited requests or 72 hours for standard requests. In 2020, Part D plans may offer members an auto-ship option for drug refills after the initial fill. Plans must send the enrollee 2 shipping reminders prior to sending the first auto-ship refill. They also must give the enrollee the opportunity to opt out of the mail order delivery of the drug. Enrollees can choose to have their shipping reminders sent via phone, email, text, or direct mail. CMS has clarified that sponsors are required to refund any refills that the beneficiary reports as unneeded or unwanted. Plans may request that the enrollee return unwanted medication, but they cannot require a return as a condition of the refund. So again, plans may request that the enrollee returns unwanted medications, but they cannot require a return as a condition of the refund. LIS asset changes for 2020. The LIS asset limit has increased for singles from $9,230 in 2019 to $9,360 in 2020. That is an increase of $130. Likewise, for couples, the limit has increased from $14,600 in 2019 to $14,800 in 2020. That is an increase of $200. In 2020, Medicare Part D enrollees will be required to spend more before they are eligible to move into the catastrophic benefit period, where beneficiary coinsurance is 5% of the cost of the drug, or $3.60 or $8.95, based off of generic or brand for LIS Extra Help. The catastrophic coverage threshold will increase from $5,100 in 2019 to $6,350 in 2020. The $1,250 increase in out-of-pocket expenses may come as an unwelcome and unbudgeted surprise in 2020. In 2014, a provision of the Affordable Care Act, which expired in 2019, limited the amount the catastrophic threshold could increase each year. MSP asset changes for 2020. The MSP asset limit has increased for singles from $7,730 in 2019 to $7,860 in 2020. That is an increase of $130. Likewise, for couples, the limit has increased from $11,600 in 2019 to $11,800 in 2020. That is an increase of $200. Income limits will come soon, as the limits are effective April 1st through March 31st of each year. Documentation. Our topics for documentation are going to include why we document and report, MAP policy and expectations, and some refresher and tips. Why do we report? Well, if we don't record who we serve, then it hasn't happened. It also allows our funders to evaluate how we are doing as a program, and it is important to document and report in ShipTools what we do with each beneficiary to allow for continuity of care. If you were to be seeing Jane Smith today, but then Jane Smith saw a new counselor 3 days later, it would be important for that new counselor to know what you and Jane Smith had discussed when you met 3 days prior. Reporting requirements. These are the requirements for reporting in ShipTools. Reporting of your MAP activities into ShipTools or using the appropriate hard copy forms, such as PAM forms, needs to be accurate, complete, and timely. Timely reporting with MAP Inc. requires reporting to be entered into ShipTools by the 10th of each month. For example, a March client contact needs to be entered into ShipTools by April 10th. PAM form information must be sent to your site coordinator the week before the 10th of each month to allow time for processing. If you are not wanting to fill out your own PAM form and would like for your site coordinator to do so, please speak with them and make sure that you set up a time that works for both of you so that the PAM form can be entered in a timely manner. All client counseling contacts are entered into ShipTools under the Client tab. If you need to send any protected information to your MAP site coordinator and you want to try to send it through email, please try to do so with encrypted email. Otherwise, hard copies can be mailed to the address listed on the slide. Any PAM forms or other forms that you need to send to your site coordinators can be sent to the following individuals. For Oakland County, Loretta Mack. Macomb and St. Clair, Bev Clark. Washtenaw, Livingston, and Monroe, Melissa Devine. And for the Region 1B, Sherry Smith. All emails for the prospective coordinators are listed on the slide. Complete and accurate reporting. When you start a client contact report, please note the counseling zip code in the first section. It will default to your home or to the center of your county or residence. Change it to where you are counseling. If you're counseling in South Lyon, but normally you counsel in Ypsilanti, change it from 48197 to 48178. When you do your client contact report, change the date to the actual date you did the counseling. It defaults to the current date. Change the date to the counseling event, counseling session, the phone call, etc., at which you spoke with that beneficiary. Likewise, the type of contact can change depending on how many contacts you have with an individual. Anytime that you have a separate conversation or counseling session with an individual, be sure to log it and choose at that point whether it was in person, telephone, email, or so forth. The number of contacts can also change the status of an individual's form from in progress to complete. Outreach reporting. One outreach event per PAM form is allowed. The type of outreach will determine the type of PAM form that's filled out. Any media events, including anything from emails, flyers, brochures to TV and radio, and a group event includes enrollment events, booths, and presentations. An outreach event may only be one type of event, such as a booth or a table, presentation, or public disbursement, newsletter, Medicare minutes, etc. Multiple activities at the same event will require individual PAM forms for each activity. Event or group names must be documented on the PAM forms. S&P reporting. It is essential to discuss and document fraud and abuse with each client and at every event. Under Section 6 of your client contact form, there are multiple options for fraud and abuse. Select all options that apply. They fall under the S&P Healthcare Fraud, Error, and Abuse boxes 65 through 72. Once selecting your boxes from 65 to 72, be sure to specify more detail not only in your notes, but also from Section 7 under Additional Topics Details. Under Section 10 Comments, you must document that there was a discussion about at least one of the fraud and abuse topics selected. It is not good enough to state gave a brochure or mailed brochure. If there is no comment listed for fraud and abuse, there is no credit given. Please remember that if there are no comments and no topics discussed, there is no credit given. This can affect future funding for the MAP program, including the MAP program in our region. If you counsel MIPA, it must be documented appropriately in ShipTools. Under Section 6, choose the correct box 11 for LIS Extra Help Application Assistance or box 43 for AdCare MSP Application Assistance. Section 8, MIPA Evaluation Outcome, LIS, MSP, both or not MIPA will auto-populate. Confirmation of application for MIPA must be printed and sent to your site coordinator by scanning and emailing, or through postal mail, including all necessary information: the beneficiary name, date of birth, submission of confirmation number, and, for LIS assistance specifically, the last four of the Social Security number. Each application is then submitted to MAP Inc. for reimbursement. LIS and MSP outreach and education also yield reimbursement. Please make sure that you get in contact with your site coordinator to learn more about the PAM forms for that. CMS Unique ID. Unique IDs are renewed yearly, January through March, and will not overlap recertification. It requires that you sign a confidentiality agreement each year, and also that you must complete the online learning modules. Those are generally posted January through April, and for this year, the module will be posted in February. Counselors with unique IDs, there's a list given to regional coordinators. You must be an active counselor, and you must report your client counseling. Confidentiality agreement. Your site coordinator will provide you a confidentiality agreement that is going to be held on file at the Area Agency on Aging 1B. This will be a yearly renewal separate from the unique IDs, and it will be collected during your recertification time. Please see your site coordinator for more information. Recertification. For a new volunteer, you must first become a certified counselor. That means you must meet 18 hours of counseling in your first 6 months after attending initial training, and also complete your ORS test and S&P modules in ShipTools. Once you're a certified volunteer and you're in the following grant year, you will need to meet 60 hours of counseling and/or outreach and attend at least 2 update trainings, complete the recertification module and test, and attend your local April update training. For certified volunteers that have been here for a while, you have the similar guidelines. You must meet 60 hours of counseling and/or outreach. It can be any combination during the grant year. And each grant year runs from April 1 through March 31 of the following year. You must attend at least 2 update trainings, which can include and are not limited to just the Lansing update trainings, but your local update trainings as well. And you must complete the recertification module and test and attend your local update training in April. Any questions?